NBC News. This is Today with Katie Couric and Matt Lauer.
We're back at 8:10 this morning on the final part of our series, Under the Knife, Desperate for Perfection, non-invasive cosmetic procedures. While the plastic surgery business is booming, not everyone wants to do that. On Monday, we introduced you to two moms in their 40s who wanted to look younger without the surgery. So we hooked them up with three experts for a head-to-teeth makeover.
My name is Rita Delaney. I'm from Auburn, Alabama, and I am 45 years old. I'm married. I have two children. When I turned 40, I guess I started thinking about my looks. I am getting wrinkles. I'm getting some crow's feet. The older I've gotten, the more crooked my teeth have gotten. There's a space and it's growing, and it has bothered me.
My name is Edie Mattia. I'm from Whippany, New Jersey, and I'm 43 years old. I have one child, a girl, 8 years old. And I'm home with her, but I also own a cheerleading gym. Things I've always wanted to fix and I'm insecure about are, number one, these wrinkles up here, okay? Two, the gap, and then I have some little marks over here too. I'm working on the inside, but I'd like to look prettier on the outside.
Dr. Marc Lowenberg is a leading cosmetic dentist whose clients include Courtney Cox and Timmy Crawford.
So we talked about the space and whether or not we were going to close it completely or not.
He decided on bonding, bleaching, and veneers for both Sandy and Reader.
I am a little nervous. I mean, I have to be honest, but I'm so excited.
Up next, New York dermatologist Deborah Wattenberg for a little Botox, Restylane, and light treatment.
I'm not a big fan of needles. I think I'll be okay. It's not permanent. So that was like, I was like, okay. And if I like it, I'll upkeep it.
And last but not least, hair coloring at the Louis Licari Salon.
I'm excited to update my look. One of my friends said, your hair has been the same since I've known you.
I'm looking forward to looking gorgeous.
And we'll reveal the ladies' new looks in just a moment. But first, we're joined by Dr. Marc Lowenberg, Dr. Deborah Wattenberg, and Dr. Louis Licari-berg.
I'll take it.
and Louis Licari.
Mom would be so happy.
How are you guys? All right, before we unveil the looks, let me first ask you, Deborah, about Botox, Restylane, and all these other products that are now being used. Are you worried that people are ODing on them? Now dentist offices are sometime offering them. They're Botox parties. Is there any cause for concern here?
Well, Botox parties are definitely not something that's appropriate. People should not be doing Botox in that type of setting. They're drinking alcohol. They're not prepared for the risks and the benefits that can occur from this, and so it shouldn't be done. Botox, Restylane, all these cosmetic procedures should be done in an appropriate setting by a professional. In terms of whether or not it's being abused, there are people who abuse these products, and you really need to go to somebody who's going to be honest with you. If you come in and you don't need a procedure done, you shouldn't have it done, and you shouldn't be pushed into doing something. If something doesn't bother you, you shouldn't do it, and you shouldn't overdo it. You know, you still want to look natural. You don't want to look plastic, and you want to make sure that you look good.
I'm sure there are people who become addicted to it and want to have it done all the time, and then it's sort of a slippery slope. They want more and more and more and more. In fact, Marc, in the New York Times yesterday, they wrote an article about whitening junkies, people who I guess can't get their teeth white enough.
Right.
Where do you draw the line?
I think the dentist, the professional, is the one that has to draw the line, because people definitely go overboard. And eventually they start looking this ridiculous color of white. So you have to stop at some point.
So many people these days look like they have chiclets instead of teeth.
Well, they may have tricklets, but,
Hopefully not.
but some people do go overboard. But most of the time, the dentist actually controls the color white that you're going to do.
All right, well, let's take a look at the ladies. First, Reader, why don't you come out, and we'll show.
Wow.
You look beautiful.
Thank you.
That's what you looked like before, Reader. And now, here is Reader today. Wow, you look amazing.
Fantastic.
All right, well, let's get right to it. Before we ask you, Reader, how you feel about your new look, Dr. Wattenberg, tell us about her skin. We have before photos, and we heard what Rita was bothered by in terms of her face. Tell us what you saw as her problem area, so to speak.
So when Rita came into the office, we were very concerned about the furrow in between her brows, and we were very worried about the wrinkles between her nose and her mouth area, and then her crow's feet, which were really starting to get very heavy. And so what we did was we injected some Restylane, and we used a little bit of Cosmoderm for some of her fine lines, and we did some Botox to help soften her lines.
And so you did the Restylane in her mouth area?
We did Restylane on her smile lines, and then we did a little bit of what's called Cosmoderm over it to help with some of the fine lines that were there and lift up the corners of her mouth and
what
make
is
her lips a little
Cosmoderm?
bit. It's a type of collagen, another filler substance. And then we injected Botox to just give her a little fresher look, make her look a little bit less tired, and just make her skin look like it's vibrant.
And Mark, tell us about Rita's new choppers.
Well, basically, she had the works done. We used porcelain veneers, JK veneers, which actually widened her smile, made her teeth look straight, and changed the color. We used bonding on the bottom teeth to close up that space, and then we bleached the rest of her teeth.
How are you feeling?
And as you can see, I didn't make them too white.
No, they look really pretty and natural. How are you feeling about this?
Oh, great.
And Louis obviously did a fabulous job with your hair, made it a little redder, right?
Right. Well, what we did, of course, is remember, hair color can just influence the skin color. And here, Stephen Beeson from the New York salon made her hair a little bit redder. And then we also layered it to give it more fullness. And then Enid gave it this beautiful eye color to show off this. Look at this eye color she has.
It's beautiful, and we show the cost of all the things that were done to Rita's skin right there on your screen. Rita, thanks so much, because now we're going to bring out our next guinea pig, Sandy Mattia. Let's show her before. This was Sandy before. We heard some of the things that she wanted to do to make herself feel better on the outside. And here is Sandy now. So, Deborah, why don't you tell us, first of all, actually, let's do Dr. Loewenberg first. Why don't you tell us, Mark, what you did to
the main thing with Sandy, if you recall, is she could not decide whether she wanted that space entirely closed or not.
I liked her Lauren Hutton gap.
Well, we can make that for you if you like it so much.
I don't like it that much.
But we used JK veneers again. We closed the space. We just did 6 veneers on the 6 front teeth to equalize the space. So none of her teeth are out of proportion. That was the great thing about using these JK veneers. It just evens out the whole smile.
And they cost, what, $600 to $2,000 per tooth?
Depending on what part of the country.
And it lasts 15 to 20 years?
Exactly.
And then, of course, you did bonding, right?
We didn't do bonding.
You didn't?
We did on Sandy.
I'm sorry. That's on Rita.
We
I'm
bleached
sorry.
her other teeth to match the color.
Okay. And then, Deborah, what did you do to
we
Sandy's
actually,
face?
Yep, we did some microdermabrasion to smooth out her skin a little bit, and then we did some Botox to raise her brow up a little bit, smooth out her forehead, and get rid of her crow's feet. And then we did some Restylane and Hyaluronic, which are both filler substances, to just soften her smile line and raise up the corner of her lips.
And this was, the Hydroform cost $500 to $1,000, Botox $500 to $1,000.
Those prices are based on the quantity that you get, number of tubes, etc.
Okay, and real quickly, Louis, about the hair.
And again, Terry layered her hair around her face. Stephen gave her these highlights, which brightened her face, smoky eyes. And the great thing about hair color and haircuts, if you ever are going to do cosmetic changes, change your hair color, and it'll take the focus off of what you really did.
Ah, good
tip.
Good clue, Louis. All right, well, what do you think?
I love it.
You look
I love
fantastic.
my new too. Thanks, Terry.
All right, well,
You
have a
look
seat.
so gorgeous.
So let us get a gander of you both. Thank you so much for doing this, and to all of you, thanks
you.
as well. I think you did a wonderful job.
The quick fix that works, right?
All right, yeah. Up next, actress